student from Mumbai Veterinary College. And today I am really happy to introduce our speaker for corneal ulcers in pets. I'll just share my screen. Yes, is it visible?
Yes.
Okay. Good evening, Dr. Komal ma'am.
Good evening, Falguni.
Okay, Dr. Komal ma'am, she is graduated from Mumbai Veterinary College from Parel in the year 2007. She has completed her master's degree in surgery and radiology from Mumbai Veterinary College as well in year
Dr. Falguni, can
2010.
you make it a full screen, please? Thank you.
It is full screen, sir.
Ma'am, go to slideshow mode, please.
Yeah.
Is it now?
No.
No, ma'am.
Okay.
Ma'am, stop share and click on share button and double click
Yes.
on first option.
Right. Can you see?
No, but that is not in full screen still.
Ma'am, stop share.
Okay.
Now click on share button. A window will pop up. Then double click on first option, ma'am. Screen or desktop. Don't directly click on PPT, ma'am.
First option.
या स्क्रीन और डेस्कटॉप एंटायर स्क्रीन के नीचे स्क्रीन या डेस्कटॉप होगा उस पर डबल क्लिक कर दीजिए मैम.
Okay. Okay.
No.
अभी भी नहीं दिख रहा?
Yes. Now it's okay.
Okay. Yeah. Okay. Dr. Komal ma'am, she has completed her master's degree in surgery and radiology from Mumbai Veterinary College as well in the year 2010 with cataract surgery in dogs as her thesis topic and has performed cataract and various other eye surgeries in different species. Currently, she is holding charge of deputy director at Mumbai Zoo and has worked in the zoo for past 14 years. She is also visiting consulting ophthalmologist at Dr. Makran Chavan and has been doing ophthalmology consultations at Dogs and Cats Vet Clinic, Dadar since 2010. She was a part of the Zoo Wildlife Vets team who performed eye surgery in an Asiatic lion at the Machia Zoo, Jodhpur. And trekking, painting, reading are some of her hobbies. Our first panelist, Dr. Narendra Chauhan. He's the director of Myra Pet Clinic and Surgical Center in Indore. He's completed his BVSC in 2003 from College of Veterinary Science and AH at Mahua, MP, India. He has completed his master's in veterinary surgery and radiology in year 2005 from College of Veterinary Science and AH in Mahua, MP as well. He's involved in veterinary ophthalmological clinical practice since 2011. He's traveled USA, Germany, China, Singapore, France, Portugal, Italy, and many other parts of the world to learn ophthalmology. He has more than 19 years of experience of general surgery, including soft tissue surgery, orthopedic surgery, oncological surgery. He has worked as a veterinary surgeon in government veterinary hospital since 2005 to 2018. He has attended more than 100 conferences and workshops in India and abroad. He has organized and attended more than 50 ophthalmic camps. He's also doing ophthalmological surgeries in India at different clinics and going to neighboring countries and performing cataract surgery courses at clinics since last 2 years. And he has trained many doctors of India, Mauritius, Malaysia, Philippines, Bangladesh, Nepal, and Sri Lanka. He has been awarded first rank in the MP Veterinary Science PSC 2005. He's been awarded as the best surgeon by MP government in 2011. He's been awarded Best Veterinarian Award by Red FM for two consecutive years in the year 2022 and 23. He's been given the Best Alumni Award by Nanaji Deshmukh Veterinary University in 2022. He's a life member of International Society of Veterinary Ophthalmology, Asian Society of Veterinary Ophthalmology, Indian Society of Veterinary Surgeon, Indian Association of Dermatology, and a life member of Indian Association of Advancement of Veterinary Research. He's a secretary of Indian Association of Dermatology in MP chapter. Our second panelist, Dr. Nilesh Dugli, he has a renowned veterinary expertise with an impressive background. Education and experiences include he has completed MBSc and PhD in 2012. He has 25 plus years of experience in the field. He is currently serving as in charge of the teaching veterinary college and a professor of ARGO at Mumbai Veterinary College Research and Academia. He has published 34 research papers. He has guided 5 PG students and co guided 25 PG students. He is a co principal investigator of 4 research projects worth 1.8 crores. He's a small animal expertise. He has expertise in small animal surgery, medicine, and diagnostic imaging. He is proficient in handling complex cases involving dogs, cats, and other small animals. And he provides consultation services for all animal hospitals and clinics. He conducts workshops and training programs for veterinarians and veterinary students on small animal practice. I now hand over the screen to Dr. Komal ma'am. And ma'am, please start your presentation.
Thank you, Dr. Falguni. So, is this visible for everybody?
Yes, ma'am.
Yeah. So, thank you, Entod, for giving me this opportunity to talk about corneal ulcers. And today I'll be talking about what are corneal ulcers, how are they caused, what are the signs that are shown by the pets, and how do you approach them, and how do you treat them, and why you should know a little bit more about corneal ulcers before you treat them. So I will start. So is it, I don't know. Okay. So what cases we usually see in our practice is a number of eye cases, and here you can see the different colors that are being exhibited by the eyes of different pets. So the first photo is of a dog with the cloudy eyes. The second photo is of a cat. So you can see the elongated pupil behind and a lot of chemoses and a lot of conjunctival hyperemia. And this is a very common case that will be seen in clinical practice. The third case is of a cat with again cloudy eyes, a lot of tearing. The fourth case is where the eye has turned red. The fifth case is again of a dog wherein the eye is completely white with a small black window inside it. And the sixth case is of a cat with a black dot. Now, the most important thing in all these cases is there is one thing that is common, and that is they are all categorized as corneal ulcers. So these are different types of corneal ulcers that are exhibited. And if I now talk in terminology, the first case is of a dog with a cloudy eye having a deep stromal ulcer. The second case is a cat with severe conjunctivitis, a deep ulcer, and a black dot in the center, which is nothing but the desmatocele. The third case is a cat again with a cloudy eye, but that ulcer is termed as a melting ulcer. The fourth case is a dog with a lot of vascularization, and this is something like an aggressive vascularization in a already healing ulcer. The fifth case is a dog with a cloudy eye, but with a central window. So this is again a desmatocele, and if not treated, this case would actually lead to rupture of an eyeball. And the sixth case is a cat with the central dot, which is black in color, and it is called as sequestrum. So all these are nothing but various types of corneal ulcers which are present in our clinical practice. So what are the usual signs that a owner will notice at home? Because when an owner comes to you as a case, he will not say Doctor, my cat or dog has an ulcer. He will tell you what he has observed in the house. For example, the first complaint would be that my cat or my dog is constantly rubbing or pawing at the eye. So, this is a sign that the animal is in pain. So, they will try to get rid of the pain not by vocalization or crying out or meowing out loud. They would try and get rid of that pain by constantly rubbing that eye with their paw, or they'll rub it onto the furniture. The second sign that they will notice is suddenly there is a lot of tearing, a lot of discharge in the eye. Sometimes they will notice the color of the discharge. Sometimes they won't probably even notice what color of the discharge is, till that eye actually gets stuck and they're unable to open that eye. The most important thing that a client or an owner would notice is change in the shape and size on the color of the eyeball. So what happens is many owners would not probably look into their pets eyes every day, and that's how they miss out many symptoms or many signs that have been exhibited when an eye case is already present. So until and unless that eye color completely turns white or blue or completely red, that's when they realize, oh, there's something wrong with my pet. Or if the eye suddenly becomes small or suddenly becomes big, that's when they start realizing there is something wrong, and that's when they get the animal to the vet for treatment. And the most common calls that I get is, doctor, my pet's eyeball has rolled up. So when you say rolled up, the first thing actually that comes to my mind is that dog or a cat having a seizure, because that's what happens during seizures, the eyeballs roll up. But actually they want to say that the third eyelid is coming up. Since they don't know the terminologies and what that third eyelid means, for them it's like the eye has completely gone white, and that is one complaint that would usually come up when they get the pets for an eye checkup. Now, as a vet, what signs do you need to see when you have a client coming in for an eye examination? So, what happens mostly is somebody comes, says, my pet has an eye infection. The first thing that the vet would do is place that animal onto the top of the table, and they will start examining the eye directly. My advice is, first and foremost important thing is history taking. You need to talk with the owner before you actually start examining the eye. So for example, when an owner comes with the pet and you know that it's an eye case, observe that animal from far, from a distance, before you actually take him on the table. See whether there is disparity between the two eyes, whether there is any swelling on any side of the head, there is tilting of the head, or there is any skin infection around the eyes, on the paws, on the face, there is any discharge which can be seen easily from far, whether the dog or cat is coming in with an eye which is already closed shut, or uh, is having say what you say different color, so that all can be seen from a distance. And when you take them on the table, that's when you actually start examining everything. So start from the eyelids, then go towards the eye. So go from outside to inside. You check whether the eyelids have any infection around, whether the eyelids are going inside, whether the eyeball is transparent or not, whether it's become cloudy or not. Check the size of the pupil. So usually the pupils, when they are resting, they are normal size. When the animal is scared, it's usually big and dilated. When they are in pain, they will constrict, so they'll become very small, and that's a sign that should be enough to tell you that this animal is in pain. Otherwise the eyeballs will not the pupil will not constrict. Check if the conjunctiva is inflamed or not, whether there's a lot of hyperemia around the eye. So what happens is, when there is an eye case, the first thing that the pet would do is close its eye because it's painful. So the eye is a sensory organ, and it has a lot of nerve fibers going in. So if there's a small hair suppose in our eye, we want to get rid of it. So imagine if there's an ulcer in a pet's eye, how painful it would be for them, because they want to get rid of it. They'll keep scratching, pawing at that face. There'll be a lot of discharge. So there's tearing. So these are the signs that usually a pet will exhibit when they have an eye infection. So why do these ulcers occur? So there are many reasons why they occur. So mostly what we see in our practice is owners get a lot of pugs, Shih Tzus, because they're small. It's a toy breed, easily manageable in a city. But what happens is these guys have exophthalmic eyes. The eyes are already bulging out. The eyelids sometimes are not able to close properly. And there's a lot of exposure, corneal exposure, which causes a lot of dryness. And they already have uh, poor quality tears. They have decreased tears. They could have KCS, and that's the reason why they tend to get more injuries. Moreover, they are brachycephalic breeds, so they have a punched face, which, what happens is it's very easy for them to get hurt or injured on the face, especially on the eye. So if they have another dog and there's a dog fight or cat, the first thing that they do, especially cats do, is they will try and scratch the face, and in that the eye gets hurt. Okay. Moreover, their ears and their eyes, they're very close. So if there's a ear infection, they tend to scratch the ears, and in that they tend to hurt their eyes. So this is very common in these breeds which are brachycephalic. And trauma is one of the reasons for the ulcers or any injury to happen. So sometimes if an owner is walking the dog goes into a place where there are a lot of thorns, or in the bushes they get hurt. So that is trauma affected, and which can cause to ulcers. Then you have eyelid malformations. So you have to check the eyelids. So there are intoning of the eyelid, which is called as the entropion. So there's constant rubbing of the hair onto the cornea, and that is what causes an ulcer. So that those ulcers would usually be at the lateral side, or wherever there is an inturning of the eyelid. So there you will find that ulcer there. Then there are distichiasis, that is extra hair coming out from the medial canthus. So the hair that comes out from the medial canthus, they are usually, if it's long and a tuft of hair, it will not actually cause ulceration, but it will, there'll be constant friction. So there might be a little pigmentation over the cornea. What happens is this hair is constantly floating in the tear film that is on the eye. So they will not directly cause an injury, but if the hair is short, stubby, it will start poking the eye, and that's when the ulcers start. So what people tend to do, or owners tend to do, is they tend to trim the hair around that area. What happens is the new hair that grows, it's very thick and very stubby, so that leads to ulceration. Then decreased tear production. So tears are very important for the eye. They are like the source of nutrition and oxygen. So if the tears are not there, the eye becomes completely dry, and it's very easy for a dry eye to get injured very fast. So then that's how ulcers occur. And dry eyes are very commonly seen in pugs, beagles, cockers. Then there is neurological deficits. So if a patient has facial paralysis, so that side of the face would probably have no nerve supply, and that causes the eyelids to not blink, and it causes the eye to get dry. So when the eyelids blink, it spreads the tears all around the eyes, and that's how the eye gets lubricated everywhere. So if there is any nerve problem, then that eye is not going to have a proper tear flow everywhere on the eye, and then those patients tend to have ulcers develop. Then there are endocrine disorders like hypothyroidism, diabetes, Cushing's, which actually cause dryness in the eye, and they also cause injuries in the eye because of the dryness. And if there's a diabetic dog, then if there's a small injury, that also takes a long time to heal, and it can get into a complicated ulcer later on. So before we go to the treatment aspect, it's important to understand the anatomy of the cornea. So cornea is a transparent structure. So why is it transparent? Is because the light has to pass through the cornea into the lens, and through that onto the retina to create an image. And it has to, if it's not transparent, if it is opaque, then the animal or any other pet will not be able to see or visualize things. So the most important thing for the cornea is to remain clear or to remain transparent so that it can refract light onto the retina. So usually the cornea is 0.5 to 0.6 mm thick, and it's more thicker in the periphery, and it's more thinner in the central part. So what happens is this cornea, it doesn't have any blood vessels, it does not have any pigment. That is why it is completely transparent. And it's a very highly organized structure. So it is divided into three main layers. One is the epithelium, which is the topmost layer. Now this epithelial layer is constantly growing. So if there is any injury, the body itself is trying to heal it by the stratified epithelium constantly multiplying and replacing the cells. So that is the most topmost layer, and it is covered by the tear film, which keeps it moist and healthy. And the stroma is the middle layer, which actually covers like more than 90% of the cornea, and it is arranged with by the collagen fibers. There are keratocytes there are macrophages, there are neutrophils, and they are all arranged in a parallel manner. So they are in a parallel manner, and that's why it's a completely transparent structure. The third layer, or the last, or the innermost layer, is the endothelium. The endothelium is something which comes in contact with the aqueous humor, and it is a single layer. That is, that if you can see, it is not like the epithelial layer, which is multiple layered. This is a single layer, and the basement membrane of this endothelium is called as the Descemet's membrane. So I will tell you all ahead why Descemet membrane is really important. And because of all these structures, this cornea remains transparent so that vision is not affected. So if you, it's like having glasses on your eyes. If your glasses are cloudy, obviously you cannot see. The same thing is with the cornea. If the cornea is cloudy, the vision gets hampered. So how do you detect corneal ulcers in dogs and cats? So first thing that I spoke was observe the animal, check for your signs, check for the symptoms. You get a rough idea when you actually observe the animal before examination. During examination, there are certain tests that you can do or perform. So as an ophthalmologist, certain equipments are required to check eyes, like an ophthalmoscope. It could be direct or indirect ophthalmoscope, a slit lamp microscope, tear strips, dye strips. But even if you all don't have that, a simple torch should be enough for you all to detect ulcers. One more thing that I would like to mention when you're doing eye check is whether it is an eye case or not. As a routine, let it be an habit for you all to always take blood temperature, body temperature. So even if it's an eye case, I would still routinely perform body check to check whether there is temperature increase or not. Not because it is mandatory for me, but it helps me correlate with the clinical signs. If the animal is running fever and it has any eye infection, I would first correlate it systematically. So this is a very routine test that is done. This is usually done to check if the eye is dry or not. It's called as a Shermer tear test. And in case of an ulcerative patient, I personally wouldn't do this because the eye is already painful. But it is equally important to do this test because we would like to know whether the ulcer is because of a dry eye or not. So I would rather do that test in the other eye, the opposite eye, so that at least I get a reading of the tear production that is there. So if I already have an ulcer and I put the strip into the eye is painful. It will have excessive tearing. Any which ways, I'm gonna get an error with the tear production level. And if it's already high, I would assume that the tears are normal. So I would rather perform this test on the opposite eye, which does not have an ulcer. Sometimes there's so much pain that the pet does not allow you to perform this test. So it's fine if you cannot perform this test on that patient at that moment. Maybe after few days later on, you can do a check for the tear production. And this is a slit lamp microscope. This is a handheld portable one, and this is used to check the entire anterior chamber of the eye. So what happens is you can actually see the different layers of the cornea. You can see the anterior chamber, you can see the aqueous humor, you can see the ciliary bodies, the iris, and the front and the back of the lens. So it's like a beam of light which moves. You have to move that beam from one corner of the eye to the other corner of the eye. So what you get or what you see is nothing but uh, transectional sections of the eye, like how you would cut a cake. You get long slices. So it's basically giving you a image of the slice of that eye in that particular plane. So you can actually, if there is inflammation inside the eye, you can actually make out flare inside the eye. You can make out any breaks in the epithelial layer of the cornea. There is any cataract that also can be detected by the slit lamp microscope. This is a costly equipment. It's not mandatory to have it as a general practitioner, but yes, if you are someone inclined to study of ophthalmology or go ahead in it, then definitely this is a must buy. The most universal and most easy to perform test is the dye test, is the fluorescent dye test, wherein you take the dye strip, you can place it onto the eye and pour a drop of water over it so that the dye trickles down the eye, and even the minutest injury in the eye will take up that dye. So you can see there's a gap in the front of the eye. So what happens when you put the dye, it will settle in this layer, and that's how you can detect corneal ulcers. These are easily available. So as a routine practitioner, you all can actually buy the dye strips and keep it handy. And you need a Woods lamp. Like, you have to actually see the dye being fluorescent under a Woods lamp. That is a blue light. It doesn't matter if you don't have the wood light. You can actually see it in a normal light also, provided that the background is completely dark. So ideally, do this dye test and check the eye in a dark room, so that there is no other light falling in on the eye except your torch, and that's when the fluorescent dye will shine up. So this is a dog. So if you see from far, you cannot see much that's happening in the eye. It's slightly cloudy, but when you do a dye test, you can see there's a minute hole or a injury on the cornea. So that's how the dye, is taken up by the slightest injury. So this is a cat scratch injury which will take up the dye. This is a superficial ulcer. That's how it stains. And these are deep ulcers. So I would like to tell you all how the cornea heals, because that is really important. Apart from knowing the anatomy, you should know what happens and why it happens. So the first layer, that is the stratified epithelium, it is constantly growing. So every 24 hours the cells get replaced, and this layer is hydrophobic. That means it does not like water, so it does not allow the tears that are there on the surface to come inside the eye. So if there is a break in that layer, then only those tears will come inside, or there will be some entry of some infection or into the eye. So whenever there is a superficial ulcer in this layer, these cells, they will start migrating as much as possible to cover up that defect. And usually what happens, if the defect is only in this layer, it will heal in the next 5 to 7 days. Okay, but if that defect goes into the stromal layer, that is the collagen layers here, it it starts what do you say, the eye starts getting more and more densely white. So these collagen layers, these are basically arranged in parallel manner. Okay, that's what keeps the transparency. But when it gets infected and the body is trying to heal this layer, the new collagen layers that are formed with the keratocytes, the collagen fibers, and the ground material, they are not arranged in a parallel manner. They are arranged in any manner, and as a result of which they become dense, and it becomes white or opaque. So when the ulcer heals in this layer, it will not usually heal without a scar. So that white or the collagen layers which are laid down while it's healing, it that's what forms a scar. Okay, and when more than 50% of this stromal layer is affected, that's when it's called a deep ulcer. Now here in the stratified epithelium, that is the upper layer, there are lot of nerves, and if there's an injury here, it's very painful. But here, slowly the nerve ending starts reducing. So as the ulcer goes deeper and deeper down, then there is no pain felt by the animal. So even if the eyeball is white, even if it has a big dent, that animal will not show squinting, or it will not close its eye, because it's not feeling any pain. But if it's a superficial ulcer, it's too painful and that eye will be shut. Now this layer, it is hydrophilic. That means it loves water. It will immediately absorb water. So whenever there is a dent in this layer, or this layer is ruptured, it will absorb all the water, and it, because of that absorption of water, the entire eye goes cloudy. So this reaction that you see in the eye when there's an ulcer indicates that the stromal layer is affected, and that is why it is getting cloudy. And the last layer is the endothelium. Now this endothelium, it cannot regrow. It, once it gets damaged, it cannot regrow. And its main function is whatever water is there, it has to pump it out, because it wants to keep the cornea transparent. Okay, and this, there's the descent membrane. So if there is a deep ulcer, and this descent membrane also does not like water, so when you put a stain or a dye, the epithelial layer will take up the dye, the stromal layer will take up the dye, but when it reaches down, the descent membrane does not take the dye. And that is an indication, if you have an ulcer wherein the surrounding area is all green, but the center has still not taken any dye, that indicates that it's a very critical situation, and this case should be referred for surgery ASAP, because this is the last layer, and if this layer breaks, then it will result in rupture of the eyeball. So ideally, the cornea, if it has to be a healthy cornea, it has to stay dehydrated, it has to have it has does not it should not have blood vessels, and uh, it should be transparent. So there are different types of ulcers. So this is a superficial ulcer. So here you can see that it's taken up the dye, and only a few layers of the cornea have been affected. The stroma is not affected as such, and it's very painful, but these are very easy to treat. This is a deep ulcer. When the stroma is affected, there's too much cloudiness. It's less painful, because as I said, the more deeper it goes, the less pain the pet will feel. And usually you have to refer for surgery to save the vision. And this is the desmatocele that I was referring to, when you can see the desmats membrane which is down, and the entire stroma has been eaten up like a well. It looks like a well. So here also there's no pain that's exhibited, but it requires surgery immediately. And this is a perforated corneal defect wherein the descemet membrane is broken and all the content has leaked out. The aqueous humor has leaked out, and along with the aqueous humor, the iris also prolapses. So this becomes like a ruptured eyeball, and this is really painful. Then indolent ulcers are ulcers which are complicated, which are superficial, but they are still not ready to heal. And these are really painful. Sometimes pain may not be exhibited if it's a long-standing case. And this is something that you have to refer to an eye expert. Melting ulcers, these are usually like very cloudy, and here you can see that the eye is literally melting like a ice cream cone, and a pain may or may not be exhibited. And this also requires, these are complicated ulcers, these require expert advice. Now, how do you treat corneal ulcers? So first is antibiotics. So before I begin the treatment, let me tell you that when there's an ulcer in the eye, the body tries a lot of effort to heal it on its own, and it is a job of the body to heal the ulcer. What we as vets are supposed to do is control infection. So when you're giving antibiotics, we are doing our best to control secondary infection, whichever would be taking place in that ulcer bed. So antibiotics usually go for the simpler ones like toba, gentamicin, neomycin. And if it doesn't work, then you switch on to the higher antibiotic. But go with the simpler ones and put 1 or 2 drops. So ideally the schedule which is mentioned in literature is every 2 hours for 1 or 2 weeks. But if it's a superficial ulcer, they'll heal in the next 5 to 7 days. For deeper ulcers, they will take at least 2 weeks to heal. It is practically not possible for an owner to put antibiotics every 2 hours. It is when you tell them 4 times a day, that's when they put 2 times a day. People are working, people are equally busy. So I would suggest antibiotics at least 4 times a day, expecting that the owner would put it at least 2 times a day. And if it's a non-cooperative dog, it's sometimes even 1 times a day becomes like a blessing for us. Okay, so antibiotics are majorly used to control the secondary infection. Second thing is pain, because these superficial ulcers or ulcers in general are very painful. So how do you manage pain is by putting atropine eye drop or tropicamide eye drop 2 times a day, at least for a week. And atropine should not be used in patients with glaucoma. So you should be aware when you're prescribing this drop that the patient does not have an increased IOP or intraocular pressure. So what does atropine do is so when there is pain, the iris will contract, and that is why the pupil becomes small, and that is because of it's a pain reaction. So when you put atropine, the pain is gone and the iris muscles relax, and that's how the pupil gets dilated. So if the pet is on atropine eye drops, you will get a dilated pupil. Now this atropine eye drop is a slightly bitter drop. So when you put it on the eye, usually the eye drops go from the eye into the tear duct, and it opens into the nose, and one part of the duct opens into the mouth. So because the drop goes into the mouth, it they can feel the taste of the drop, and when it's bitter they start frothing, which is especially seen in case of cats. And this excessive frothing, it's so bitter sometimes that they start vomiting also. So in such cases you have to make the client aware that this drop will cause excessive frothing, and if it's too bad, do let us know. We will change the drop to something lesser in potency. But this is required if there is pain. Then you have lachromomimetics, that is carboxymethyl cellulose. These are lubricants because you want to keep the eye moist. You don't want it to go more dry. The more drier it goes, the more difficult it becomes for the eye to heal the ulcer. So usually one drop every 4 hours till the ulcer heals. I usually prescribe lubricants for at least 2 weeks or maybe 3 weeks. And after the ulcer heals, if there is a underlying condition of KCS, that is keratoconjunctivitis sicca, then I would prescribe stimulants that will increase the tear production, like cyclosporin, and that can be done 2 times a day. uh, you can prescribe cyclosporin even when the ulcer is healing, provided you know that it is a KCS which has caused the ulcer. NSAIDs, that is non-steroidal anti-inflammatory. So we want the inflammation to occur so that the eye heals the ulcer. What happens with NSAIDs is that you are putting flurbiprofen and it will affect the inflammatory process. So we don't want the inflammatory process to stop. We want it there so that the eye heals. Okay, so sometimes what happens is that it also takes care of the pain. So I would prescribe it one drop once a day for at least 4 days. And definitely it has to be given in deep ulcers where there is inflammation, because there's severe uveitis and you want to control that uveitis is inflammation of the eye. And for that, then I would prefer flurbiprofen. So this is the body's mechanism. So when there's an ulcer, the body is trying its best to heal the eye. And how does it heal? Is by allowing the growth of the blood vessels. So these blood vessels are coming from the limbus. Limbus is the junction between the sclera and the cornea. And these blood vessels are trying very hard to reach this central defect to heal. So you have the superficial blood vessels, which will be seen especially in the superficial ulcers. And if there's a stromal ulcer, then the deeper vessels will be seen. And these deeper vessels are like paintbrush strokes. Okay, so they take a long time to travel because the stroma is a tightly packed layer. So it takes a long time for them to come to the center, and you will usually see a paintbrush like stroke appearance on the periphery. If it's a superficial ulcer, the blood vessels will be more branching, more like a tree shape, and they will try and reach that defect faster and it will heal. So here you can see the vessels which have been branched superficially, they have reached the defect and they have cured the defect. Now, since this is a stromal ulcer, you can see a central scar because the newly laid collagen fibers, they are not in an organized manner, and that is why the transparency in this area has been lost. So it forms a scar or a white dot. This dot does not affect the vision of the eye, but it's like having a small speck on your sunglasses or your eyeglasses, but you can still see through them. However, if the defect is bigger and deeper, then the scar will affect the vision. So why do some ulcers do not heal? So there are many factors, because if there's an ulcer say in one pug, it will heal differently than an ulcer seen in the same species, same age, but it depends on the individual healing capacity also. So there are many factors. So one is the breed. So especially in brachycephalic and exophthalmic eyes, the eyelids are not able to close, they're not able to blink properly, and there's a lot of this the canthus is pretty large, so it causes a lot of exposure keratitis. So even if there's a, say if you have two cases, you have a lab and a pug, the lab would probably heal much faster and quickly than a pug who will have a more complicated ulcer healing. So it's the breed also that affects the healing of the eye. Then is the age. Younger dogs heal faster than the older ones. The other thing is the tear film. So if the tears are not there, the eye uh, it becomes very dry and it affects the healing process. Then you have the, as I said, palpable confirmation. So you have your eyelids, you have to check the eyelids, if they are having a larger cancers, if there's too much exposure of the eyeball, if there's any interning of the eyelids. So when you're treating an ulcer, as I said, you should also see around the eye, because if you're treating the ulcer and it's not healing, that means you've still not diagnosed the underlying cause why the ulcer was present in the first place. So here you can see distichiasis, wherein this constant rubbing of the hair onto the eyeball. So you will treat this ulcer, but if you're not treating this, this ulcer will reoccur again. In case of ectopic cilia, that is hair coming out from the eyelid in a downward manner. So if I show you all the photo, uh, here. So here you can see this ectopic cilia. So this is constantly rubbing, and when there is an ulcer here at this position, at the 12 o'clock position, it is it's most likely to be because of these constantly rubbing hair, and it's most likely to be an elliptical ulcer. Then there is the blink rate. So if the dog is not blinking much, the tears are not continuously being spread over the eye, that also affects the healing process. Then metabolic diseases, if there's an underlying thyroid or diabetes, it will affect the healing of the eye. And most important is client compliance. So many a times the client forgets to put an e-collar. They will give bath, they'll give shampoo, they'll take them to the spa, they'll take them with the windows rolled down, and those factors affect healing, because there is a chemical going into the eye. It's already painful. You're putting shampoo, it's just because the dog is smelling, it just is not going to help the eye heal. So whenever you have an eye ulcer or an eye infection, make sure that you're telling your owner that a e-collar is compulsory 24 by 7. Advise them to remove the collar only when the dog or the cat wants to eat or drink food. They can sleep with the collar on, they can do all their activities with the collar on, they can go for a walk. For the first initial 1 or 2 days there will be discomfort, they will not like the collar because it affects their field of vision, they are uncomfortable and they want to get rid of it. But they get used to it once they know that this is not going to come off my head, and they will bear with it, and it will actually help heal the eye. So whenever there's an eye infection and there is time period for you to refer it to an eye expert, make sure that whatever treatment you're doing, advise e-collar compulsory, just write it down on the prescription. Because if at night they remove the collar, and the first reaction of the dog would be to scratch the eye, and it can actually turn worse. So when corneal ulcers don't heal, usually corneal cytology is performed, because sometimes we need to know if there needs to be a change of antibiotic, or whether the bacteria it's a neosyphilic infection, or it's there are a lot of neutrophils, or there's rods, cocci or fungus, and then you can change that treatment accordingly. So for corneal cytology, you can use a cyto brush. This is a special brush. You just have to scrape it onto the eye, take it and put it on the this slide, and then you stain it, and you can observe it under the microscope. So it's a quick lab procedure that you can do it in house. And if you don't have a cyto brush, you can use a scalpel blade, the blunt end of the scalpel blade, and you can scrape the eye. Now, when you want to scrape the eye, make sure that you're going to numb the eye with a topical analgesic drop, so that it will not they will not feel what you're doing, and you just put that drop proparacaine, and you wait for 10 minutes, let it act, and then you can perform this. You actually don't need sedation for this can be done under topical analgesia, and only if the dog or the cat is non-compliant, then you can go for sedation. So do not use cotton tip applicators when you are scraping, because otherwise the entire material will get stuck onto the cotton tip. We want it to come onto the slide, and it, when you use the cotton tip applicators, it gets stuck there, it nothing comes onto the slide. And if it's a deep ulcer, do not perform this technique. This is only for ulcers which don't heal, or you want to find out what is exactly causing that ulcer, and that's or maybe a superficial ulcer, or if the eye is something weird looking and you want to know whether it is an inflammatory process or autoimmune disease, then you go for this process. Now, these are complicated ulcers. This is an indolent ulcer. They are also called as boxer ulcers or spontaneous chronic corneal epithelial defect. So the everything is in the name. So it's a superficial ulcer. So superficial ulcers are supposed to heal in the 5 to 7 days. When they don't heal, they become chronic spontaneously. So that's why it's called spontaneous chronic corneal. And since this is an uh, epithelium that is affected, it is an epithelial defect. So these are usually seen in the boxer breeds, and that's why it's also called as the boxer ulcers. Indolent ulcers, the characteristic is that if you can see this picture, there you can see different layers of the cornea. Okay, and these layers are not sticking to each other. So as a result, the eye is not healing, the ulcer is not healing, new layers are being formed, but there is no adhesion to the underlying layer. So when you put a dye, this dye will seep through the layers, so it will go in between the two layers. And if you see something like this, that means it's an indolent ulcer, and you have to change the treatment protocol. So in case of indolent ulcers, usually grid or punctate keratectomy is done, or debridement is done. So in case of grid or punctate keratectomy, usually parallel incisions are made with the help of a 25 to 27 gauge needle tip. You can bend the needle tip at 90 degrees to get a better angle, and linear scraping is done superficially. You cannot go deep, about 1 to 2 mm apart, and it's done in a grid like fashion. So like boxes of vertical lines and horizontal lines. And just make sure that you're not uh, doing deep cuts. You can do this without sedation with topical analgesia, but do not perform this procedure in case of cats, because they will develop a sequestrum. So if you get usually cats, I have not seen cats with indolent ulcers so far, but even for any other ulcers, do not perform this procedure for cats. The most commonly used technique to treat indolent ulcers in practice is debridement, because you want to get rid of the loose epithelium. Once you get rid of the loose epithelium, then only the new epithelium will come, and it will get stuck to the actual defect. So you can use cotton buds. So you can use cotton buds. You can just move them around in a circular manner, and you can scrape the cornea for all the loose epithelium. And what I use is, I earlier used to use cotton buds, then I shifted to burring. So this is a diamond burr, and what it does is it runs on battery, and you just press the button, and it will go like a small hand grinder, and it will just lose the loose epithelium will all be removed. So this is known as an agar brush, and this is what is used for debridement. Now you can do debridement once a week, or you can do it say once in 4 days. There has to be some gap, because you want the new epithelium to grow. So every time you see this patient with an indolent ulcer, so the first time you've seen it's an indolent ulcer, the second time when you debride it, and you see it for the third time, do the dye test every time, so that you know how much of the ulcer is healing. So till the time the ulcer does not take up the dye, you have to debride the ulcer. So usually debridement works in 1 or 2 settings. Sometimes it may require 4 or more settings. And if all of this doesn't work, then you have to go for keratectomy and go for corneal flap surgeries. So how do you approach indolent ulcers? The same way as ulcers, but along with debridement. So you give them antibiotics 2 to 4 times a day, topical antibiotics, do pain management with atropine, and you give oral NSAIDs. I'm not mentioning topical NSAIDs here, and you encourage healing. That is by debriding the corneal defect, and e-collar is compulsory. So, and you have to inform the owner that this will take more than 2 to 3 weeks because this ulcer is not healing. So otherwise they don't understand why we are doing this procedure. So make them aware that this will take at least 4 weeks to heal. If it heals in 1 or 2 sittings, the more the merrier. And my general advice to clients when they are putting drops is make sure that you're putting the drops in such a way that your fingers don't touch the nozzle of the eye drop, and the nozzle does not touch the eye. So there has to be a gap between the eye and the nozzle of the drop. And make sure that you lift your pet onto a table. It becomes easier to have the dog at your eye level to put the drops if it's a non-compliant one, rather than going down to their level and they will not comply to eye drops. If putting eye drops becomes difficult, then I usually tell the owners to muzzle. But dogs or cats, they are very smart. The moment they see the muzzle, they run away and they don't want to put more drops. So I would advise in such cases to go for an e-collar. So with the e-collar, you can hold the e-collar with the neck, with your hand from the neck below, and it becomes easier for you to instill drops. Or you have to take help of some other person, especially in case of non-compliant dogs and cats. Then in case of melting ulcers, now this is also a complicated ulcer. Now here you can see that the entire cornea has become white and it has become gelatinous. It's literally melting like a ice cream cone. So it becomes conical in shape, and when you see it sideways, it feels like it's going to melt away. So this is basically because of collagenolisis. So what's happening is there are neutrophils in the stroma, there are macrophages, and they are producing and the enzyme collagenase to kill the bacteria. But sometimes what happens is the body does not let itself heal the eye, and that's when the body fails to realize that it, instead of healing, it's causing more damage to the eye, and it goes on eating up the stromal layers and they start melting away. Now this is also a very painful condition, and this is usually also seen in brachycephalic breeds, and it can result in reduced corneal sensitivity, and there can be a lot of episcleral congestion. Now sometimes what happens is because the eye is so cloudy, you cannot understand how many layers have been affected. There could be a desmatocele inside, and it could also lead to a rupture. So if there is a sign, so these are basically superficial ulcers only, which get complicated and then become deep stromal ulcers. And apart from being deep stromal ulcers, they get further complicated and they start melting away. And when this happens, a treatment protocol is as such: you give them antibiotics, you start them oral antibiotics also along with the topical antibiotics. Usually the drug that is used in such conditions is doxytetracycline, because this reduces the collagenous activity, and the pain relief is important, so you give atropine. Because there is a lot of uveitis, you can give NSAIDs, systemic NSAIDs. Topical NSAIDs can be avoided because you want reepithelialization to happen. You don't want it to further degrade more. Do not give corticosteroids in case of ulcers. So if there is an ulcer, usually vets would uh, prescribe Ciplox-D because that's the easily available and we've been using it since many years. In my practice, I rarely have used dexamethasone drops or prednisolone drops until unless it is required for that case. So avoid using corticosteroid drops as your first line of treatment. You all are in fact ruining the case when you use corticosteroids until and unless it is FDT negative and you know that that case requires it, then only you give corticosteroids. You have to use lubricants. You want to keep the eye moist, and in such cases of corneal melting, you have to prescribe EDTA drops. So what I usually do is I take the calcium EDTA vials that are there for blood collection. I put the lubricating drop. I make that drop and I prescribe it to the client to put it every 2 hours. So the calcium is EDTA drops. It will stop the collagenous activity and it will form stronger bonds in the stroma so that the ulcer will start healing. And many a times people have done serum therapy for reepithelialization, um, and if nothing of this works, go for surgery, refer to a ophthalmologist, and he will do a corneal flap or he will do a conjunctival flap. So there are different surgical treatments that are usually done for deep corneal ulcers. So literature mentions temporary tarsorrhaphy and third eyelid flap, which I'm not a big fan of, because when you're doing temporary tarsorrhaphy, so what happens is you want the eye to heal faster. So you close the eyelids, you suture them up, and you want them, you want the eye to be protected. But what happens is when you're doing this, you cannot visualize the eye. You cannot visualize the eye for a number of days once the surgery is done. And when you open the sutures, sometimes if you are lucky, it heals very good. But if it doesn't, as I said, individual healing differs. You can actually end up with a indolent or a melting ulcer. So if it's an ulcer, I usually don't go for temporary tarsorrhaphy. This procedure is well suited for cases which have proptost eyeball. The eyeball is popping out. Definitely, then you do this technique, but not for ulcers. Even the third eyelid flap, wherein you take the third eyelid and suture it to the upper eyelid. Uh, I'm not a big fan of that either, because you cannot visualize what's happening behind that third eyelid. Obviously, it is acting as a protective mechanism, but if it's an ulcer, you should be seeing the eye every day. So either you go for keratotomy, but make sure that it's not a very deep ulcer, otherwise you will end up rupturing it. And the best methods would be flap surgery, so conjunctival flap or corneoconjunctival transposition flaps. So this is how a corneal conjunctival flap surgery is performed, wherein you remove a piece of conjunctiva and slide it to the center of the eye or wherever that defect of the ulcer is present, and then you suture it. The main purpose of doing this is because the eye is not able to heal on its own, and in spite of having blood vessels, still the blood vessels are not reaching the central defect. We are taking the blood vessel source and directly putting it onto the cornea so that it heals faster. So you are basically taking that bunch of blood vessels, putting it on the cornea and giving it nutrition and uh, initiating that inflammatory process so that it starts reepithelialization and starts fighting the infection. So this is how a conjunctival flap surgery is done. In this, the flap is to be kept for the next 6 to 8 weeks, after which the flap is cut at the pedicle and at the stalk, and then it will regress on its own. And the e-collar has to be kept on for at least 2 to 3 weeks. After that, once you know that the flap has been stuck to the eye and it's not going to come off easily, you can allow the owners to remove the e-collar. In this, many a times people do the flap and then they suture the eyelids temporary, so that the flap gets stuck for the next 3 days, and after that you can open the eye. And it's important to see the flap every day, because you don't want the flap to roll up again. So then again you have to either go for another surgery or just let it heal as it is. But e-collar is compulsory when you do this surgery. And after the surgery you still have to continue the drops till the eye heals. Now this is corneo-conjunctival transposition. So in this, so you can see the first, you can see there is an ulcer. So there is what is done is, you debride that portion, you remove all the dead tissue as much as you can, and then you take an incision in such a way, diagonally starting from the ulcer, such that you cut a portion of the cornea that is healthy, as well as you take the conjunctival layer, and then you slide it towards the ulcer bed. So you have a healthy cornea along with the conjunctival layer coming and covering up the defects. So in such cases, the scarring becomes very less, because you are actually sliding a healthy portion of the cornea onto the defect. So this also works fantastically in case of deep ulcers. Now there's something called as corneal dystrophy. So many a times you will have patients with a central white portion in the eye, and this is usually because of excessive fat or calcium or cholesterol in the blood, and it could be related with the metabolic diseases. And in such cases, these deposits are in the subepithelial layer, so you cannot actually do anything for it. There's no treatment for it. You can do diet modification. And if it's a very chronic case and there is degeneration of the cornea, and then only in such cases you go for surgery. But if it's just a dystrophy, wherein there is just deposits, there's no usually treatment required. Now I'll tell you the difference between corneal dystrophy and degeneration. So corneal dystrophy is usually an inherited condition. It is rarely seen in cats, and breeds like beagle, cocker spaniel, king's charles, cavalier spaniel, miniature schnauzer, these dogs are usually affected, and it will occur in both the eyes. So it is something that they're born with, and these are nothing but deposits that are made up of calcium and cholesterol. And usually they will have underlying Cushing's or thyroid or diabetes. Now in case of corneal degeneration, you will find, apart from these deposits, blood vessels. So that it's a very painful condition. While corneal dystrophy is not a painful condition, corneal degeneration is very painful. Now sometimes what happens is, these deposits which are inside the eye in the subepithelial layer, they'll start pushing out and start coming onto the surface, and then it starts causing pain, and then the blood vessels start coming in. And then it's usually found in older patients. And then there is a history of trauma or ulcer before, and that is why these deposits these calcium deposits are coming in that ulcer bed. And uh, debridement with the help of a agar brush is usually done in, if it's very painful, and you have to keep treating the eye forever in such cases. Then lipid keratopathy is when the eye is healing. There are lipid deposits that keep coming in because of the blood vessels, and also this is because of high levels of cholesterol in the blood. This is not painful, but this is like secondary to dystrophy and degeneration. Now in case of cats, so in case of cats, they do tend to have superficial and uh, deep ulcers. But there is one thing that occurs in cats which is rarely seen or almost not seen in dogs, and that is the sequestrum. And this is because of the virus, feline herpes virus. So whenever there's an ulcer, the feline herpes virus, it is responsible for this black deposition of the pigment. And in such cases, The pigment is removed with the blade, and then a corneal flap is put so that it heals. Now, why this is important is because many a times cat owners think it's not necessary to vaccinate their cats, but when you don't vaccinate cats and then they get an eye ulcer or an infection, the herpes virus is already present in the eye, in the blood vessels. It's a common virus which is there. It starts eating up the cornea, and that's how the sequestrum forms. Many a times owners are still not ready to operate the sequestrum. So in such cases, I would prescribe care. Let the sequestrum reduce. Sequestrum cannot go away on its own. It requires surgery. You tell the owner, you educate them. See, we've done the treatment. It will not go. You have to opt for surgery at one point or the other. The moment you stop the drops, the pain is going to come back to the cat. So if you don't want to do the surgery now, if you want to do it later, just keep putting care. When you are ready, we have to get the sequestrum. The more you delay, the more deeper and more denser and wider the sequestrum occurs. So it becomes very difficult to perform surgeries later on, in later stages. So it's better to perform it when they are small and can be easily removed. So there are other therapies also for treating corneal ulcers. So cyanoacrylate tissue glue or a fibrin glue can be used to treat ulcers. But the thing is that so what happens is, if there is a deep ulcer and you want to perforate, get it perforated, you want to save that eye, you don't have time. So usually the tissue glue is put. So it polymerizes immediately once it comes in contact with water. But what happens is becomes a irregular surface, so it can start irritating the eyelids every time the dog or the cat blinks. And in such cases, then you have to put a contact bandage lens to protect the eye. And usually as the eye heals, this glue will finally fall off on its own. Now there is a new technology that has come, and that is a device called as Vetuvir, which uses ultraviolet UVA rays and riboflavin. So what they do is they put the riboflavin drops, and then they treat the eye with ultraviolet A radiations, and that's how they heal ulcers. Then the other method that can be used is chemical or thermal cauterization, wherein the cornea is scraped with the help of a blade. You wash it with 1:5 betadine, and you can use either chemical or thermal cautery. The chemical cautery, you use carbolic acid, and thermal cautery, you use thermocautery, and then you put atropine to take care of the pain, and then you put a lot of ointment, and then you bandage the eye, and you can treat it further. But mostly people don't follow these things. Then when is the right time to stop doing treatment on your own and refer it to an eye specialist? Whenever there's a sequestrum, there's an indolent ulcer, whenever there's a melting ulcer, or any deep ulcer where you feel that I have done the preliminary treatment, but I cannot do more, or I cannot understand anymore what is happening with the eye. Please refer to an eye specialist. It's better to save the eye than to be blamed that why did you not refer me to an eye specialist who was there in your local vicinity, because your client will not leave you and go to another doctor. He will trust you, but if you don't refer them to a specialist at that period of time, it's like a breach of trust, and they feel you should have told me about this. I could have saved my pet's eye. So do referrals. There's nothing wrong with referral practices, and I feel that ophthalmologists will not snatch your clients, because I don't think they're interested in anything except the eyes. They would not snatch your pets for anything else. So be assured about that. So a takeaway message for everybody is an eye for an eye. It's your duty to check your pets, or you have to tell the owners to check your pet's eyes regularly, not once in a while or when it goes bad. Every day when your playing with them, cuddling them, grooming them. Just have a quick look at the eye. When you see eyes every day, the slightest change can be noticed. So even if the eye goes slightly hazy, the owner will come to you immediately. Keep the ears clean, keep the ears free of infection, because many a times ear infection is what causes them to scratch and injure their eye. Maintain that ear hygiene. If you are advising your owners about eye hygiene, then tell them about how to clean the eye, get rid of the gunk. Do not use tissue papers, do not use plain cotton. Wet the cotton and then clean it. You can use any water, not necessarily lukewarm water or hot water or cold water, just or distilled water. Just dip the cotton ball in water and clean the eye, get rid of the gunk. And do not shampoo your pets if they have an eye infection. I usually advise owners, wherever, even if they don't have an eye infection, shampoo neck below. Avoid putting shampoo on the face. You can clean the face with just plain water. And if you're afraid that the shampoo will go in the eye, put an e-collar and then give them a bath. So you avoid many of the injuries are because of dogs going to a spa or the shampoo going into the eye. Vaccinate your dogs and cats, it's very important. And if there is any sick kitten, especially with herpes, keep them separate. Maintain that quarantine protocols, and put an e-collar compulsory for any eye case, whether it is superficial ulcer or a deep ulcer, or if you feel the eye is inflamed. Do not put full trust on the client, because they are equally busy as you. Advising an e-collar is not costly. It will just save the further consequences of rupture of an eyeball if timely precautions are taken. And refer to ophthalmologist whenever you all are in trouble or you all don't understand the case. Do not wait to solve the cases on your own. And preferably tell your clients to do an eye checkup at least once in 4 months, if not once in 6 months, so that they also know what has to be checked. What happens nowadays is so much inbreeding that eyelid problems are very common, cataract cases are very common. So if it's an inbreeding issue, you can detect them at an earlier stage and you can correct them early. Thank you. I hope all of y'all have kept your eyes and ears open. And if y'all have any more questions or doubts, I'm ready to solve them.
Thank you, ma'am. That was such an informative, in depth. You went to the fundamentals and also, recent things, new things that people try and have been doing. There are some questions from the audience. I would go one by one through them.
Yeah.
The first is, what are the risk factors for spontaneous corneal ulceration?
What are the risk factors for
Spontaneous
spontaneous?
corneal ulcerations.
Like, are they trying to say for the indolent ulcers?
It's probably unclear. We can skip. We can go to the next if they make it more clear
So
in
risk
the.
factors. So if there is any ulcer, no, the risk factor is, if you don't do the timely treatment, if you don't put an e-collar, it will it will lead to rupture of eyeball, because for that dog, he wants to get rid of the pain as much as you want to get rid of the pain. So he will keep scratching, and the ultimate risk is to, whenever you have to think, no, you have to think that I want to save the eye. If the eye is there, the vision is there. If there's no eye, there's no vision. So simple.
Okay. So next is, how does a corneal ulcer progress to a melting ulcer?
So as I said, so the stroma, no, it is made up of collagen fibers, and it has neutrophils, macrophages, keratocytes. So when The tear film also has neutrophils. So these neutrophils, the macrophages, bacteria, they are all releasing the enzyme, and that enzyme starts degrading the stroma, and that's how it starts melting. So if I have to explain it to an owner, I tell them it's the eye tears which are not allowing the eye to heal, and that's why the cornea is melting. So that is a very simple way of putting the thing. It's because the collagenous activity, and the treatment is also involved in stopping this collagenous activity for melting, and that is done by the EDTA drops.
So, ma'am, about the EDTA thing that you had said, that you take the blue vial and then how do you make it actually?
So you take the refresh drops, any lubricating drops, refresh or wet eye tears or whatever it is, and you what I do is I take those. So ideally, a very small micrograms of that calcium EDTA is required. So if you don't know how much it is, you just take the vial that we use for blood collection, which is containing already calcium EDTA in it. You put that refresh drops, or you put the lubricating drop, you shake it and you remove it and you put it back into the bottle, and you tell them to put this drop every 2 hours, so that the collagenous activity is reduced and it forms stronger. Calcium also helps in forming stronger bonds on the cornea.
Right, very interesting. Next question is, what are the common pathogens involved in corneal ulcer infection in pets?
So you have Pseudomonas, you have Streptococcus. So basically, bacteria comes when it's the layers get exposed. So the body will take care of the bacterial infection, because the stroma has neutrophils, macrophages. So the first line, that what happens is, when there is an ulcer, the first thing that happens is the epithelium starts moving because it wants to cover the defect, and the stromal neutrophils and all come to attack all the bacteria which is there. And after this is done, the macrophages come because they want to get rid of the debris. Now what happens is, if there is any complications in such a way that the none of this actual natural process is of healing works, then it starts getting complicated. So you don't want the bacteria to grow more, and that is why you're putting antibiotics there. So that is how there is normal Streptococcus, Pseudomonas, rods, fungus, they will all come in there.
Right, right. Can a corneal ulcer heal on its own?
Corneal ulcers heal on their own, but it depends on number of factors. It depends on the healing capacity of that animal. So for example, if it's a wild animal and it has an ulcer, it's impossible, if it's impossible to sometimes treat them. So in those cases, they heal on their own. There might be a few complications, there might be a few adhesions, but they heal because the main function of the body is to heal whatever is the defect. It's when there's some problem that the body fails to heal, and that is why you keep putting, you want the healing to get fastened, you want the pain to reduce, and that is why we are putting antibiotic drops, that is why we are putting painkillers in the eye, giving painkillers systematically so that it heals much faster. But ulcers are very painful. So ideally, if you say that there's an ulcer and it will heal on its own, yes, it will heal on its own, but there's so much pain that the animal wants to scratch, and because of that it goes more bad. That is why we have to intervene.
Ma'am, in cases of pain management, you said we should not use NSAIDs or steroids on the eye, and we can give them systemically. But
so
instead of those, okay, okay, go ahead,
so
go ahead.
yeah, no, complete your question, because I think
Instead
there
of
are two
those,
questions mixed in that one question. So
yeah, yeah, can we use opioids as well, or will that help in the eye ulcer
anything
healing?
like orally you're saying?
Yes, yes, orally, systemically, can we inject?
You can, so you have to control pain. But corticosteroids, what they do is they affect the epithelialization process. You want the body, your body is already doing its process of epithelialization, it's doing its process of healing. So when you give corticosteroids in a drop form or oral form, it is going to affect the epithelialization. So you're not helping the body, you're telling the body, uh, like you're actually going against the body. So
Okay.
ideally avoid corticosteroids. Corticosteroids are to be not given in corneal ulcers, and where non-steroidal anti-inflammatory are concerned, you give them only when there is severe uveitis or severe infection. So inflammation is important for healing the ulcers. You want the inflammation there so that there'll be neutrophils coming in, there'll be blood vessels coming in, help the healing process. But when inflammation is too much or more than what is required, then it becomes a problem. Then your NSAIDs come into play, because you don't want so much inflammation that is affecting the healing process altogether.
All right. So opioids should help in pain as well if we give it
Yes,
systemically orally.
yes.
Great. Okay. Can corneal ulcers reoccur?
Reoccur means if there is a patient with a corneal ulcer, it's not like he's not going to get a corneal ulcer. So if the underlying cause is not treated, so if there's an eyelid problem and you're not treating that problem, obviously that corneal ulcer will occur. Or if there is a dry eye problem and you're not treating it, you heal the ulcer but you're not giving them lubricants, then it will come back again. Or if there is a growth on the eyelid and it is scratching the eye, you're not treating it, it will come back again. There is ectopic cilia. So you have to know what is the underlying cause, why the ulcer took place in the first case. If you treating ulcers is easy, but if you don't know the cause, why it
Mm-hmm.
happened, it will keep coming back.
It will come back. Right. How long does it take for a corneal ulcer to heal?
So superficial, it will heal in a week. Deep, it will take 2 weeks. If they are complicated, then it will take more than a month or so.
Mm-hmm. Ma'am, about the serum that we can administer, what is the category of the cat or the dog that we can retrieve the serum from? Do they, I mean, if they have had herpes virus in the past?
So if there is herpes virus infection already, that serum should not be taken, because then you are introducing that infection when you're putting serum. So basically serum therapy is nothing but you have a lot of macrophages and inflammatory cells, and those, because the body is unable to do it for that period of time, you are taking the serum which is rich in inflammatory cells and you're putting it directly on the defect. So you are helping the body to heal. So if there is a herpes virus infection already, uh, I mean, if you have taken serum from a cat which has a herpes virus, then it's a very bad idea. Okay, so whenever you're taking serum, it has to be from a healthy dog or a cat. You can use a cat serum for a dog, you can use a dog serum for a cat. Serum can be stored in the freezer for 180 days, and once you take the serum, you have to tell the owner to keep it in the fridge. So in the fridge it will last for at least 5 to 7 days, and after that you have to discard. But the amount of serum that you usually get is around not more than 3 ml or something. So usually an eye specialist will keep a serum bank so that whenever there's an emergency, he can easily give it to the owner. And because he has to put it every 2 hours or every hour, 24 by 7 for the next 3 days, it actually works wonders. Um, and just that he should keep it immediately back in the fridge, because you don't want the serum to get contaminated, then it will not work.
Right, right. Another question: which oral painkiller is best to treat corneal ulcers?
Tramadol, you can use Adnoc, you can use meloxicam, anyone. There's nothing as such.
Okay, okay. I think, ma'am, that was the last question for today.
I
Very
hope
good.
it was not very complicated, because
No.
there's a lot of terms and terminologies.
No, it was pretty basic, ma'am, for a general practitioner. It was really, you went to the depths and the layers and everything. It was pretty basic and also advanced. Really liked it.
Thank you so much.
I would now like to introduce the owner of Entod company, Mr. Masurkar, in a minute. Ma'am, could you stop sharing your screen,
Yes,
please?
yeah, definitely, definitely.
Okay, is the screen visible? Hello?
Yes.
Yes. Okay, okay. Mr. Nikhil Masurkar is a CEO of Entod company, and he's often called as the India's eye drops man and the Elon Musk of the Indian pharma industry. He's highly qualified research pharmacist from King's College, UK, London, with various clinical pharmacy and formulation research accreditations to his name. He is a member of prestigious Royal Pharmaceutical Society in the UK. His dedication to indigenous research, patient centric solutions, and pioneering treatment reflects his commitment to advancing healthcare in both human and veterinary segments, that is, fur by Entod, in his last venture, taking care of furry friends by the help of technology driven brands. In essence, he stands as a beacon of innovation and leadership in pharmaceutical industry, driving Entod Pharmaceuticals to new heights of success and shaping the future of healthcare in India beyond India and beyond. Over to you, Mr. Nikhil.
Yeah, hi, good evening,
Good evening.
everyone. Firstly, I think it's a great talk by Dr. Komal ma'am on corneal ulcers. Uh,
Thank you so much.
We've seen similar talks, in the human segments. So it's very, very, it was it summed it up really well. And I think it'll give really great guidance to, for all the vets to treat such rather difficult conditions. So actually, I just wanted to say a few words, actually. So just to um, give you a brief introduction of our company. So we are an ophthalmic ENT and derma specialty pharma company. We were started in 1977. My grandfather, had a great interest in eye care, in skin care, and in ENT medicine. And he launched Crocin in the market all the way back in the late 1950s, early 60s. But his passion was for eye care, ENT. So he started Entod based on that. We were one of the first ophthalmic manufacturers in India. And we moved on from being a contract manufacturer towards our own R&D, marketing, and sales. Today, we have almost 1,200 people on the ground in ophthalmology. We have over 200 ophthalmic products and over 100 ENT products in our range. And we are almost there in 67 countries worldwide. And we're one of the top fastest growing in the ophthalmic segments in India, domestically, and in many other markets. So to enter the veterinary field in Opthal was basically, it's something that had to happen. We just needed a bit of confidence in terms of what we're doing in the veterinary field. So a lot of the formulations that we had in for human form, we had to re-optimize it a bit in the for veterinary form, mainly to adjust the viscosity a bit. The preparations for in the ocular surface for pets needed to be slightly more viscous than for humans. So we had to make those changes. And we started with an ophthal segment. I mean, it's quite a niche area within the veterinary field, and everyone told us don't go into that because the market is very small. But we never believed those things. I think for us, we realized that there was a gap in the market, and in a gap in the therapeutics. And we've been seeing a lot of pets having increased kind of increasing eye problems of late. I myself have two cats, and I've had one of them had an eye problem for a long time. And being in the eye care field, I had no idea how to treat it. So you can imagine somebody else who has no experience in this. And that's when I realized that, we need to do something for our animals. And we're doing so much in the human field, and why not do something in the veterinary field, especially cats and dogs. So this is how we started. Now, today we have, I think, almost 13 to 14 ophthalmic products. We have some ENT products as well, and we have many others in the pipeline in the veterinary field. But I think more than just supplying medicines for us, it's always been about the research, the academics, and if this division of ours could boost or improve the ophthalmic, therapeutic management and surgical management in the veterinary segment, then I think then that will be a great win-win for all of us. So it's not just about having medicines and all of that. That's very easy. The more difficult part is to kind of grow the awareness of veterinary ophthalmology in India, and to take it to every corner of India, like how we've done for the in the human form as well. So that's all I wanted to say. So thanks for having us as part of this webinar, and I'm sure that moving forward there'll be many such more academics, not just in the area of corneal care, but also maybe in veterinary cataract surgery, treatment of glaucoma, and a whole range of conditions which currently there is the management isn't that advanced in India. But I'm sure we can work together, and we have some great vets in India, and I'm sure that we can have these academics and really push this super specialty segment within veterinary medicine further. So thank you all. Thanks a lot for your
Hello,
hearing.
hello, Mr. Masukar. I'm Dr. Nilesh Dagli.
Yes, hello, sir.
I think we met at our Mumbai Veterinary College once, and then at your R&D sector. I just wanted to know, I'm very curious. I think you have explained also at that time. Actually, what is the meaning of word Entod? Entod. Means it's very catchy word. So you would like to
Yeah.
throw some light on that.
So when my grandfather started the company, one thing he noticed was that people were focusing on every other body system or organ system except the five basic senses. So it stands for ears, which is the sense of the sense of hearing. N, nose, the sense of smell. T, throat, the sense of taste. O, ophthalmology or eyes, the sense of sight. And D, dermatology, that's the sense of touch. So he wanted to have something that could enhance these five senses, which we all take for granted. And when things go wrong with our eyes or ears, we don't know what to do. We panic. Whereas everything else, more or less, nowadays we've learned how to manage it, be it metabolic conditions and diabetes and heart problems, cancers, and all of that. But these are the kind of things which are most ignored. And in today's day, and we are under unprecedented stress when it comes to our eyes and ears. So that's how Entod started. That was the name. That was the meaning behind the name.
So one more question, last question from my side, that we are using a lot of Entod products nowadays. Anything new product you have in mind which can go in the veterinary market? Anything in pipeline?
Yeah, so right now, I mean, we've launched most of the molecules that we were advised that would work in the ophthalmic sector. There is a lot more we can do, especially in the area of dry eye. So we just recently launched, tacrolimus eye ointment, for severe, dry eyes and VKC and those kind of conditions. We launched cyclosporin eye drops as well. Maybe we could launch a higher strength of cyclosporin as well. I think the one that we have is a standard strength of 0.05%, but also there is a higher strength 0.1%, which we have in human medicine as well. So that's something that can be launched. On the other hand, in terms of completely new formulations, we could also look at certain disease modifying drugs in the corneal segment, like tofacitinib eye drops, for example. Obviously, this will have to be studied. And because in the human segment, we're doing a lot of indigenous formulation work for which we've been recognized by the Department of Pharmaceuticals, I'm sure we can take it forward, also carry it towards in the veterinary segment as well. But at the same time, any of you vets, any doctors, if they all have suggestions in terms of what is needed, because more than us, I think you all know where are the gaps in therapeutics. Then you can always let us know, and we're happy to work with all of you to kind of come out with those things. We have the infrastructure to launch literally anything in the market. We have a great regulatory team, the R&D team, and also at DCGI level as well. So there's a lot that can be done. So right now, these are the things in the pipeline, but we are waiting for suggestions from doctors, to guide us further in this area.
Yeah, thank you, sir. And
Thank you
very
so much.
nice lecture, Dr. Komal. I must appreciate. Very informative and a very useful lecture for all the practitioners.
Thank you so much, sir. And I thank Mr. Nikhil and his entire team for the efforts that have been taken since your legacy. You are running the legacy, I should say. And thank you for diverting what do you say, your vision towards veterinary sciences. So it's actually so what happens is many a times we see things abroad and then we learn abroad, and then that's what we want to try out here, but unfortunately certain things are not available in India. And you've actually given us a good feedback that if we have any solutions that we actually need, and you can help us in getting that in the market, then that's like the cherry on the cake. So thank you for that. And I actually thank the Entod team for calling me for this forum to speak to the vets. And I my aim was that I should simplify things so that nobody screws up any eye case, because losing an eye is equally painful for the pet as well as for the owner. So thank you for everything, sir.
Yeah, I think Falguni madam, she got a log out. Narendra sir is also available. Narendra Chauhan sir. Sir, just as a take-home message on this today's topic, if you are audible to us. Nilesh sir?
Yes. Hello.
Yeah.
Yeah. See,
So we
basically, every client has to be educated for eye care. As Komal has very rightly pointed out, clients are we have seen a lot of cases of pug, Shih Tzu, popping eye, and they come up with the problem of some sort of eye problem. Initial stage, they treat their pet at their own only. They put some eye drop which contains steroids. They go to the medical store. They ask for some eye drop, and the medical people will give them the normal routine eye drops. And then the condition worsens. And then it becomes very difficult. So whenever the pet parent comes, we should have a checklist to give them to take care of their eyes. If we could make such type of checklist that if you will take this type of care to your pet, your eye will be protected. So every pet parent should be made aware for such type of ophthalmic care. That is what I feel.
okay. Thank you, sir.
Yeah.
So we'll close the
Thank
meeting.
you, everyone. Thank you.
Thank you. Bye bye.
Bye.